like walking on a piece of glass, something real sharp. It was almost unbearable.
It's hard to imagine the pain Dorthea Kennedy lived with for 10 years due to a nerve disorder called complex regional pain syndrome, a neurological condition that can occur after a surgery or trauma, causing extreme skin sensitivity, numbness, and tingling.
Sheets hurt. To have a sheet touching you, that's how bad it was.
Unable to walk, she used a scooter or cane to get around.
There was days I'd crawl around. I'd have to crawl to the bathroom. I'd have to crawl to my chair that's in my bedroom.
Steroid use for the pain pushed her weight to more than 200 pounds. Frustrated and exhausted, Kennedy turned to SSM Pain Care at St. Joseph Hospital West in Lake St. Louis and Dr. Ramis Gheith to be evaluated for spinal cord stimulation.
Spinal cord stimulation is based on pacemaker technology. It actually came to fruition in the late 1960s when research studies were done at that time. It sends an electrical stimulation signal to the spinal cord, and by doing so involves the closure of a theoretical pain gate that's involved in transmission of pain signals from the lower back or the lower extremities or even the arms to the brain.
The pain signals are masked by a tingling sensation in the area where the pain resides. Each patient undergoes a trial screening to make sure the stimulator is significantly reducing the pain. During the screening, 2 leads are placed in the epidural space along the spine. This X-ray shows the leads in place for the test.
You want to make sure that this placement is perfect. We want to cover the entire area that the patient's experiencing pain, and that requires talking to the patient, having the patient awake during the procedure, but yet comfortable.
Feel anything there?
Nope.
A device consultant and the doctor guide the patient through the trial.
Well, you might feel a sensation down one or both your legs as I start to insert the second lead here. This is where the actual current is coming from.
If the trial is a success, then the leads and battery pack are placed permanently during outpatient surgery.
When he did the permanent surgery, I felt instant relief. After I got up and moved around, it was such a relief. And I've lost so much weight because I'm not on the drugs. I'm not on the steroids. So that has to help.
Conditions treated include failed back syndrome, degenerative disc and spine disease, unsuccessful back surgery, and complex regional pain syndrome. For Kennedy, the surgery has meant a return to normal life, including doing housework. Today, the chairlift that for 10 years carried her upstairs to go to bed at night has a new use.
Put a laundry basket on it, and that's what it's used for.
Dr. Gheith says today spinal cord stimulation surgery is also being used as an option before major back surgery.
This particular procedure initially when it came out was utilized after back surgeries and in some cases after multiple back surgeries. However, these days they are becoming more commonly used for patients prior to back surgery and prior to repeat back surgeries.
Each patient gets a remote to control the battery pack and strength of the current. Recovery from this minimally invasive surgery takes about 2 weeks.
The majority of the patients come back with exciting news about the amount of function that they've had.
New patients need a referral from their primary care doctor to an interventional pain specialist.
You look like a different woman. You know, every time we see you, you'll just look better and better.
At SSM Pain Care, it's about teaming advanced technology with a healing touch to manage chronic pain and improve quality of life.
For 10 years, I have been in my scooters, in walkers, in canes. My grandson's in the service. He left in August to go to Afghanistan. He said, Grandma, are you going to be okay? And I said, are you? And he said, yeah. So then when he came home last month, he was just totally shocked. It's been wonderful, you know. He hugged me and he says, I have my grandma back. After all these years, I have my grandma. I can hug her and it doesn't hurt. I've tried everything else, nothing worked. This works. Have a good life. And you can be a new person.
For a referral to Dr. Ramis Gheith or other SSM pain specialists, call 1-866-SSM-DOCS.